in the hospital, and sadly, 7,638 people who have died. We continue to pray for those in North Carolina and across the country who've lost loved ones and those who are still battling this cruel virus. Just a few days ago, our country endured a violent attack on our nation's capital, the seat of our democracy. It left death and destruction, along with threats by some that there is more to come. This assault on our democracy was the result of dangerous rhetoric, lies, and disinformation that spread far and wide. It's a stark reminder that our words matter. Words are powerful and can be used to help or harm. Last week, we saw how the words of elected leaders can cost lives. Lies and misinformation have cost lives during this pandemic as well. Our nation experienced a one-day peak in reported COVID-19 deaths on Thursday with 4,085. More people could be alive today, but for dangerous falsehoods that have been spread about the critical importance of masks, social distancing, and other common sense safety rules. Words matter. People listen to leaders and often follow their calls and imitate their actions. As the death toll from this pandemic continues to increase, our leaders must listen to science, focus on the facts, and tell the truth with their words and the examples that they set. The truth is that this disease is spreading fast. We are in a dire situation. The truth is, in order to save lives, people need to follow the safety protocols we have in place. That means wearing a mask when we go out, practicing social distancing, abiding by the modified stay-at-home order, and avoiding gatherings with people who aren't in your household. These simple measures work. Another truth is that the vaccines are safe and effective, and they will save lives. Helping local health departments, hospitals, and other healthcare providers get vaccines in arms as quickly and as equitably as possible remains our top priority. The state is continuing to see a steady increase in vaccination rates, which is good. We expect that to continue. The North Carolina Department of Health and Human Services is working with several local communities to stand up large-scale vaccination events in the coming days that can help get these doses out efficiently into our communities. They're partnering with 14 health systems, local health departments, and community centers in 13 counties, and expect to give more than 45,000 vaccines just with those. The state already is providing support to local health departments for staffing support. And the Department of Health and Human Services and State Emergency Management have identified hundreds of state employees who can be deployed to assist with vaccine distribution in communities across the state. We are encouraging other locals to ask the state for help. Now, I know that many of you are worried about your loved ones and yourselves, and you want to get a vaccine as soon as possible. Right now, local health departments, hospitals, and other providers are vaccinating healthcare workers who are treating COVID-19 patients. And up next are people age 75 and older, and some areas have already started that, which is good. Vaccine supply across the country is severely limited, but the goal is for us here to distribute as quickly as possible all of the vaccines given to North Carolina by the federal government, and to be ready for much more. People are working night and day to make that happen. And at this time, I will recognize our Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, for an update. Dr. Cohen.
Thank you, Governor. As you noted, the events of last week brought home how dangerous and deadly misinformation can be. They also painted a vivid picture of how differently people experience what it is to be American based on their race and ethnicity. Too often, it is the color of someone's skin that predicts their health outcomes. In almost every health measure, communities of color fare worse, including in this pandemic. The root causes are complex, interconnected, and rooted in structural racism, implicit bias, and longstanding inequities. The pandemic didn't create the disparities, it just made them acutely visible for all to see. At the outset of this pandemic, Black and Hispanic Latinx North Carolinians experienced much higher rates of COVID-19 than their white neighbors. And Black North Carolinians were disproportionately dying from the virus. Our team has worked hard to do better. Embedded in all of our COVID-19 response is the goal of achieving health equity by investing in and directing resources to historically marginalized populations and by working with trusted community partners. When we look at the data, since the start of this pandemic, we are seeing progress. While Black and African American communities make up 22% of North Carolina's population, they are now 20% of the cases and 26% of deaths. That has improved since the summer when Black and African Americans were 33% of deaths. Hispanic and Latinx North Carolinians are still experiencing higher case rates. While they're just under 10% of our population, they are 24% of cases and 8% of deaths. Though we're making progress since the summer when they were at 45% of cases. We still have work to do. We know that the injustices that drive these disparities can also cause very legitimate reasons for people to be hesitant about vaccines. We're working hard to ensure historically marginalized populations are informed about the importance of getting vaccinated. We want them to know it is safe and that it is critically important that all North Carolinians, including communities of color, and those who work in hospital settings, both caregivers and residents within long-term care, people on the front lines, and our older residents. That's why we are partnering with trusted leaders and organizations to provide accurate information to communities. Our new video for older North Carolinians is a great example, and so let's take a moment to watch it right now.
I want all the people who are my age to enjoy their golden years.
I mean, it just makes good sense to try to protect yourself.
I've got great-grandchildren out there I haven't seen, and I'm looking forward to that.
I'm asking my seniors and my young people to encourage.
Healthy helps keep your neighbor, your friends, your relatives, helps keep them healthy too.
I'm excited, relieved, and grateful, and take
There are things I still have left to do, and I'm going to fight this head on. I'm going to get vaccinated.
I feel very much that this allows me to be more in control of my life, less fearful. Doesn't mean I won't wear a mask, I will.
If we take it seriously, we can be past the horrors of 2020.
If you have a spot, take your shot.
You have a spot.
Take your shot.
You have a special spot, so please take your shot.
You have a spot.
take your shot.
This video and others are on our website, yourspotyourshot.nc.gov. As the governor mentioned, we continue to accelerate vaccinations over the past 7 days compared to the week before. Over 100,000 doses were given in just the past 7 days. Because of how the vaccines are shipped, the timing of those shipments, and the amount of vaccine available in the country, most vaccine sites have very limited supplies. Therefore, while most of our counties have started vaccinating anyone over 75 and older, there will still be a wait for most people. While the department, our hospitals, and our local health departments are working hard to scale up vaccines, we're also in the midst of the most dangerous moment yet in this pandemic. On Saturday, we had well over 11,000 new cases reported in just 24 hours. The percent of our tests that are positive is over 13%, well above the 5% mark I'd like to see. Our hospitals are stretched. Yesterday, they reported that 75% of staffed hospital beds were in use and 84% of staffed ICU beds were in use. This virus is everywhere. Just over our borders, on our doorstep, it's even worse. In South Carolina, 25% of tests were positive yesterday. Virginia, 16%. In Georgia, 18%. We cannot let down our guard. North Carolinians should stay home. You should only leave home for essential activities such as going to work or school, for healthcare, to care for family members, or buy food. Keep up with the 3 W's. Always wear a face mask. Wait 6 feet apart and wash your hands often. You can save lives. Whatever your reason, get behind the mask. And remember, you have a spot. Take your shot. Thank you, Governor.
Thank you, Dr. Cohen. As you can see, North Carolina continues to increase the pace of vaccinations. And Dr. Cohen's serious warnings need to be heard and acted on. After almost a year battling this virus, we must not get numb to the numbers. They are not just statistics or data points on a graph. Behind these cases and these numbers are real people, our neighbors, friends, family members, coworkers, North Carolinians. Preventing the spread of COVID-19 and saving lives is up to each of us right now. Words are powerful, and it's time to use them for good. North Carolinians are strong, and I know we are up to the task. Also with me today is Secretary of Public Safety Eric Hooks, Emergency Management Director Mike Sprayberry, Commissioner of Prisons Todd Ishii, and National Guard Adjutant General Todd Hunt. Monica McGee and Brian Tipton are our sign language interpreters. Behind the scenes, Jackie Mativier and Erica Kugler are our Spanish language interpreters. We'll now take questions from the media, and if you can give us your name and your organization, we'll take the first one.
Our first question is from Derek Dellinger with Fox 46.
Thank you for taking my question. This is Derek Dellinger with Fox 46 News. I have a question I think is probably more applicable for Dr. Cohen on the numbers of people that are declining the vaccine. We know that this is not necessarily mandatory in some respects, but I'm wondering if the numbers of people that have been declining the vaccine so far, is it significant?
We are particularly concerned about people who are turning down the vaccine, who are staffing our long-term healthcare facilities. But it's one of the reasons why the department is getting out the public service announcements like you just saw, and working hard at the grassroots level to try to raise the level of trust. But I'll let Dr. Cohen address that.
Hi, Garrett. The governor got it exactly right. We are concerned, and we are seeing a higher rate of decline of the vaccine, particularly in those in our African American and Hispanic communities. We are working with a number of community organizations, training them on all of the vaccine info that they might need to answer questions for their own community members. We continue to do that day over day, and it's been a great partnership. And I think this is where we need all of the folks in the media. We've been talking today about words mattering and making sure that we can get out good information. And I thank all our partners in the media for helping us get out the good information about vaccines. They are safe, they are effective, they've been tested. You cannot get COVID from the vaccine. Folks need to be hearing those messages from trusted sources of information to make sure when they're shot, their spot to take a shot comes up, that they do in fact say yes to that vaccine. We know it is the way we are going to beat back this pandemic. Thank you.
Next question, please.
Follow-up, Derek Dellinger, Fox 46.
My second question does not have to do with COVID. It actually has to do with any extra security measures or any potential worries you are worried about over the next few days, specifically at the Capitol, possibly even the governor's mansion, and any security measures that are being taken place to ensure the safety of legislators, but also, for that matter, yourself and also the state employees that are there.
There is concern about the potential threats of violence, well, threats that are already out there. Our Secretary of the Department of Public Safety has been coordinating with local and federal officials, and Secretary Hooks, I might let you say a word to people about that. This is Secretary of Public Safety, Eric Hooks.
Thank you, Governor. As the governor's mentioned, I have been in constant contact with all of our partners in state law enforcement, local law enforcement, and our federal partners as well. In fact, last night I talked at length with the special agent in charge with the FBI as we talked about potential eventualities there. We want to make sure that we maintain a high level of vigilance, that we're well partnered, and that we're well positioned to address any threat that comes our way.
Thank you, Mr. Secretary. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. The feds just said today that they're now urging states to vaccinate everyone age 65 and older and any adult under 65 with documented health issues. So why isn't North Carolina changing to follow those federal guidelines? And are health departments able to vaccinate 7 days a week? And what kind of help do they need to get that happening now?
Well, first, it's the #1 priority of the state of North Carolina to get vaccines administered to people as quickly and as equitably as possible. One of the continuing problems that we have had with the federal government is that they have continued to shift their advice on what the priorities for the vaccine should be. I mean, we all know that there are severely limited amounts of vaccines. Manufacturers are making them now, but we have known from the get-go that we were going to need to prioritize vaccines. And we have seen several iterations of their recommendations to the state. And I just got off the phone with Vice President Pence and the Coronavirus Task Force, and for the first time, it was put forth that states should look at not only 75 and older for the first tranche after healthcare workers working with COVID-19 patients, but then move to 65 through age 74. This recommendation, I think, was based upon the fact that the virus is so widespread across the country that we know that older people get hit with this. I know that Dr. Cohen is going to go back to her staff. Right now, the state is in vaccinating healthcare workers working with COVID and vaccinating people 75 and over. So we have not gotten to the next tranche of people yet. So we will look at that to determine whether that should be done. It makes sense to consider doing that. And as for expanding hours of vaccinations, a lot of local health departments and hospitals have in a very short time used up their supplies very quickly. But there's no question in my mind that places that are taking longer to distribute their doses should have more hours. And I'll let Dr. Cohen comment on all of that.
Thank you, Governor. Yes, we will take the new recommendations that literally are coming out. We haven't even seen them in writing yet, but we will examine those and understand how that fits into the work that we've been doing. Obviously, we have a North Carolina Vaccine Advisory Committee that has been pulled together as well. We're going to want their input, and then we'll come back obviously very quickly. Getting this kind of advice in the middle of all this is obviously very challenging, but we will take a look at that and incorporate it into our work going forward. And as far as helping our local health departments, I want to commend that there are a number of them who are doing a tremendous job and have no vaccine left. They have given all the vaccine that they have, and I think they've been doing a terrific job. There are others though that still have vaccine, and we need to support them in getting that out. Whether that's, as the governor said, expanded hours, if it's answering the phones, if it's checking folks in, if it's actually delivering the vaccine. We want to be helpful. I want to thank my partners in emergency management who are coordinating this effort to help pair staffing support to our counties. The National Guard is certainly one piece of it, but just a small piece of a larger staffing effort. So help is available to our local partners. We're actually going one by one, calling them, asking them, how can we help you be successful with getting all the vaccine you have out within the next week? So we're partnering with them in any way that we can to support them in getting the vaccine out, to heed the governor's call for us to work urgently and to get all of our vaccine out as quickly as possible.
Next question, please.
Follow-up, Don Vaughn, News and Observer.
Hi, thanks for the follow-up. So how quickly is our potential criteria going to change then with this new federal guidance? And how quickly can these health departments be open 7 days a week or get that support so they can get out all the vaccines that we have already? And you mentioned that there are large-scale vaccinations that are stepping up. Do you have any details about that?
Well, first, we want to make sure that these vaccines get out as quickly and efficiently as possible. And already we have provided help to local health departments and hospitals and are ready to supply that help anytime. As to the criteria, we want to make sure that we have that criteria changed if we're going to, before we move into the next group. So I know that Dr. Cohen and her advisory committee will work very quickly to make sure that we adjust our recommendations accordingly. Dr. Redfield and Secretary Azar were on the phone today. I don't know if the CDC advisory committee, who has been working on this, has agreed with the moving to age 65 group. But we're going to look at that and I think come forward very quickly with recommendations so that we will move it out into the next ones. And I don't know if Dr. Cohen, you got specifics on these other things.
Hi, Dawn. On our high throughput vaccination sites, we essentially asked providers across the state how, if we were able to allocate additional vaccine, how much could you scale up in this next week? And essentially, we're working with 10 sites across the state, some here in the Triangle, the Triad, in the Charlotte area, in the West, in Asheville, Buncombe area, and then as well as out east. So covering the geography of the state, but also these higher throughput sites where we believe we can get out as much as 45,000 vaccinations, as the governor mentioned earlier, but just at those sites alone, in addition to all of the other sites that are working across our state. Those sites have already done some press, I know here. Appreciate our partners at Wake Med, UNC, Duke, who are supporting those efforts in the Triangle area. I know that they've been standing those up and accelerating and scaling their work. So we're appreciative of those partners that have stepped forward. In addition, we continue to hear of great offers of support and partnership, and we're working through that. And I'm so appreciative when folks are offering space, vaccinators, as well as other logistical help. And we're certainly integrating that into our plan, and are certainly very appreciative of that as we move forward in our work. Thank you.
Next question, please.
Our next question is from Liam Collins with WITN.
Yes, this is Liam Collins with WITN. Thanks for taking my question. I know we were saying that we are accelerating quickly in terms of vaccinations, but CDC's data suggests that the state is at the 6th lowest in the country for vaccine rollout. Several small counties have just begun their vaccination process, whereas our neighbors like Virginia are already vaccinating teachers and police officers. I'm wondering what is your understanding for why the state hasn't been able to get the vaccines off the shelves as some of our other states with higher percentages?
Thanks for that. I think everyone shares a sense of urgency to vaccinate as quickly as possible, and states are approaching this differently. I know my partners in Virginia, who we talk to often, instead of going directly to those who are 75 and older, went to some of their frontline essential workers first. Again, how are they going to integrate this new guidance from the federal government? I bet we will have a phone call to understand how they are handling it, but each state is doing this slightly differently. For us, initially, we prioritized getting vaccine out to all 100 counties. We wanted there to be an access point in all 100 counties here. And so now what we are making sure is that all 100 counties and all of those access points can, in fact, really get that vaccine out. And if they can't, figure out how can we support them to be successful. And if we need to, have them transfer that vaccine to others who can get that vaccine out. So that is why you're seeing us rebalance and think about these higher throughput sites in addition to supporting all of our counties with additional access points. We'll continue to work urgently to make sure we can get as many vaccines out as quickly as possible. Thank you.
Next question, please.
Follow up, Liam Collins, WITN.
Yes, just a quick follow-up on a different subject. The county health departments have said that they haven't been getting as much Moderna vaccine as hospitals in our area have been getting the Pfizer vaccine. What is the reasoning behind that, and how much exactly is being sent out across the state?
Hi, Liam. I think this speaks back to the fact that the way the vaccine is packaged by each manufacturer is different. For the Pfizer vaccine, in order to ship them, they have to come in a pack or a unit of 975 doses. So if you get any Pfizer, you have to get at least 975 doses. Moderna packs differently. It packs 100. And so depending on how we did that allocation, if one place in a county was going to get a Pfizer allocation, they were automatically going to get 975. So the math isn't perfect here because of the way folks are shipped. What we tried to do was balance the number of doses per population in the county, then look at the number of vaccine sites and administration partners that we had, and then distribute that. But again, because of that packaging, it wasn't always precise. What we have seen is great partnership between health departments and hospitals where we actually ask them to share that 975. So that's terrific. And we want to support more of that partnership. We just want to get this out faster. And if folks need more arms and legs, people to answer the phone, whatever they need, we want to help them make sure that they can get this vaccine out quickly. Thank you.
Next question, please.
Our next question is from Laura Lee with Carolina Public Press.
Good afternoon, Governor. It's Laura Lee from Carolina Public Press. Thank you for taking my question. You all spoke a little bit earlier about the disproportionate impact on Black and Brown North Carolinians in terms of COVID cases. And when you look at the mortality data, you see, disproportionate rates for mortality for Black and Brown individuals that would correlate to that population gap between 65 and 75. So I just wondered if you could speak a little bit about the decision not to yet move to what the federal CDC recommended this morning, which would have included population 65 and over.
Well, first, there's been no decision yet for North Carolina about whether we are going to follow the recommendation that we just got a couple of hours ago. We want to take the time to look at it and talk with our partners. But I would think that maybe we would want to do that. But I'll let Dr. Cohen address the rest of your question.
Thanks for the question. I think the reason we didn't exclusively go with age as our first way of approaching this is because age alone doesn't address some of the equity issues that you mentioned in your question. We know because of historical health inequities that unfortunately life expectancy for those who are African American or Hispanic are not as long, and thus age alone actually doesn't adjust. That is why we also wanted to take into account exposure to this virus, particularly for those who are on the front lines of needing to leave their home to go to work. And even when they do that work, can't be socially distant. I'm thinking of our police officers, I'm thinking of childcare workers and others who have been going to work, whether it's to protect us or take care of our children throughout this pandemic. And so I think when we were originally approaching this, we were looking at both the risk of death and disease from COVID as well as exposure. Now with this new guidance, we definitely want to take that in, understand the CDC guidance here. Again, we haven't even seen that in writing yet. We will work with our vaccine advisory committee, and then we will make sure that we are communicating as quickly as we can how we're going to incorporate that. Thank you.
Next question, please.
Follow up, Laura Lee, Carolina Public Press.
Thank you for that. My other question is about the 45,000 doses that will go to these high throughput stations that you're setting up. Are those doses going to come out of the allocation, that the 120, I think is the estimate, weekly allocation? And are there concerns about people in less populated places not being able to receive vaccine if those 45 are diverted to these larger population centers?
One thing, people can travel across the state to get vaccines, and they're going to work to put these high throughput places in some of the rural areas, particularly in places where local health departments may be struggling to administer the vaccine. I think that there are going to be even more providers who are going to be involved in this process. The 45,000 does come out of North Carolina's allotment. Dr. Cohen.
Hi, Laura. The way we got to be able to allocate going forward is we looked to see who had vaccine that they were still administering, and then we weren't going to allocate them any in addition. So by not allocating certain folks additional vaccine while they used up their backlog, we were able to accumulate enough to put towards these high throughput sites. There were some sites who, when we said, would you like additional vaccine? They said, no, we actually needed to decline it for a variety of reasons. Again, that helped us contribute to these high throughput sites as well. So we did do a reallocation based on the efficiency of getting our vaccine out. And that's how we're able to get to some of these high throughput sites as we go forward.
Next question, please.
Our next question is from Travis Fain with WRAL.
Yeah, thank you, Governor. I know you had the call today with the Vice President. I wonder if any of the other governors on the call asked him about invoking the 25th Amendment, and if so, what his answer was.
No, no one did. It was exclusively about the pandemic and prevention measures, and it was the entire coronavirus task force with Secretary Azar, Director Redfield, Dr. Birx, and so nobody that I heard. To come in here, I had to leave a staffer listening to some of the very last of the meeting where governors were making some comments. So something could have been said after I left the room to come in here to do this. Next question, please.
Our next question is from Chandler Morgan with WBTV.
This is Chandler Morgan from WBTV. Several major hospitals in Charlotte are reporting 85 to 95% ICU beds occupied. Is that something that's concerning to you? And then what will the state do to help support hospitals if needed?
First, it is deeply concerning to us, and Dr. Cohen is talking to hospital CEOs almost on a daily basis. I've had a number of conversations with them as well. And I think the first thing that a hospital CEO would tell each and every one of us if he or she talked to us would be, please wear your mask, Please be socially distant. Please wash your hands. Please follow the safety protocols, because we have a lot of safety protocols in place. And they know that the more this virus is spread, the more people who are going to get it, the more people who are going to get sick and have to come into their hospitals and the ICU beds. So they would tell you about that. And we are deeply concerned about it. They learned a lot as we geared up this past spring, and many of them are reducing and some eliminating their elective procedures in order to free up beds. And we are offering any assistance to them that they need, and we'll continue to communicate with them as we go forward. Do you want to add anything to that? Dr. Cohen says no. Next question, please.
Follow-up, Chandler Morgan, WBTV.
Hi, Governor. I have a follow-up question related to education. With the rising cases, why hasn't the guidance changed for school operations? Why are certain grade levels still allowed to go to school under Plan A with the least amount of social distancing, which you guys continue to repeat is important, when cases are continuing to be concerning?
Well, first, we have left options for schools, plans A, B, or C, which all require strong safety protocols in the schools. There was a recent study done by Duke and I think UNC that showed that there was very little virus spread coming from our public schools, which is a good thing, which shows us that many schools are abiding by the safety protocols. We're continuing to leave that as a local option as to whether the school is in Plan A, B, or C. Dr. Cohen, would you want to add anything to that? She does not. Next question, please.
Our next question is from Michael Hyland with CBS 17.
Hi, this is Michael Hyland at CBS 17. I had a question related to the first come, first serve vaccine distribution sites we've been seeing. You all been reiterating the guidance for people to stay home as much as possible and for people 65 and older to even get their medications and groceries delivered to them. Yet we're seeing people line up for hours at a time, sometimes not even getting the vaccine. So are you going to ask the vaccine providers to stop doing the first come, first serve method and switch to appointments? And is there anything getting in the way of doing that?
Well, first, I'll let Dr. Cohen respond to this, but I will say that the guidance given to local health departments and hospitals strongly recommends appointments. Our emergency management teams have been activated, and we've contacted emergency management directors in each county to provide help to local health departments if they need help answering the phone, if they need help with technical assistance. We also have the National Guard activated to help do that. So we strongly recommend appointments, even if it's in groups, because we know that it's not good to have people in line, and particularly that age. But I'll let Dr. Cohen address that specifically.
Well, Governor, you handled that perfectly, and that is our guidance to try to do appointments. But what I would say is I see a lot of counties, if they are moving to a first come, first serve, they're doing it as drive-through, which I applaud. So if you're going to do that, not use appointments, trying to keep everyone social distance and use the cars, similar to how we did with testing, that can keep everyone distant. They could stay in their car, and they can move through as they get those vaccine sites up. But again, we are encouraging best practices of doing appointments, but if you are going to be doing that first come, first serve, to do that as a drive-through is a better practice than having folks wait potentially in person in a line. Thanks.
Next question, please.
Our final question is from Jason DeBruin with North Carolina Public Radio.
Hi, thanks for the question. This is Jason DeBruin, North Carolina Public Radio. So talking a little bit about the high throughput sites, I suppose that implies that there are also low throughput sites. You sort of talked about those. I wonder, is it fair to think about this first round of distribution as almost like a trial run by DHHS, where you wanted to see which counties were going to be able to get the vaccine out quickly into arms and sort of identify the ones that needed a little bit of help so that now maybe in the second round and third round of distributions, as you said, you can sort of target some areas for more doses of vaccine and others for fewer?
Thanks for that question. We did prioritize getting the vaccine into all 100 counties. And so to all of our local health departments and to hospitals that were in all of our counties. And because the supply was so limited, for certain counties, that could mean 100 doses for an entire week. So when we're talking about high throughput and 45,000 in a week at 10 sites, there are some that have just a few doses over the course of a week, but we wanted to make sure we got that geographic distribution. I think what we're trying to find is that right balance of speed as well as that geographic distribution. But we also want to be focused on other types of equity. We were talking about making sure that our African American and Hispanic Latinx communities are having access to the vaccine as well. So we're trying to employ a lot of strategies, and we will continue to evolve this to make sure we're solving for speed and we're solving for equity at the same time. Thank you.
Thank you all very much for joining us today. We encourage everybody to continue to follow safety protocols and to stay safe. Thank you so much.